Hi, Ladybugs. How's everybody doing? I'm doing okay. It's been a little bit of a stressful day. I was having some issues with my phone, but I'm working it out, so it's okay. It's okay. How's everybody's day going? I hope your day is going fabulous. I hope you're having a fabulous day. For real. I just hope you guys are having a great day and everything is peaceful in your lives. Sorry, I'm looking through a bag while I'm talking. So we've talked a couple of times about why I don't go out very much, and I thought I would talk. I thought we would talk a little bit about that today because I've had some questions from people about that situation because I've never actually shared the situation. I've just kind of alluded to it. So I thought today we will talk about that a little bit, and yeah, I thought that would be interesting. So it's not that I don't go out. I do go out. I don't go out very much. And when I do, like, it's just to the store. It used to be that I used to go out a lot, and I would hang out at the mall and I would go to a lot of stores, and I was really kind of just a social person. So I was always out and about. And then I had a situation happen. Hold on. I'm just looking at something real quick. Anyway, then I had a situation happen, and when I was out one day, and it really like drastically affected me. So I thought that I would talk about that today. And the issues with my phone, it's nothing serious. I have a little bit of issues with my storage, which I guess when you become a content creator, you need a lot of storage on your phone, but because I had never done anything like that, I was just not aware of that fact. So I'm kind of getting my bearings, and I'm stumbling around a little bit, but I'm getting there. I'm learning, it's a process. It just takes time to learn things and, be able to figure out what all needs to happen when you make content. It's a new process for me. So, because like I said, I've only been doing it a few months. I started back in April, and I didn't even really start making a lot of videos in April. I didn't start that until like the end of May. So it's really very, very new. And I'm just not totally on top of it yet, but I'm getting there. So I'm getting there. It's a learning curve. So I'm pulling out some outfits because I want to dress some babies, and then I want to tell you guys about that situation. But what I'm going to do instead of just telling you about it is I do much better when my thoughts are organized and I write things down. It's just the way that my mind works better. And I actually had posted about this particular situation on Facebook I think it was a couple years ago now. And so I thought I would just kind of read that because it's easier for me to be able to keep my thoughts organized if I have something written down. So yeah, I thought I'd do that today and tell you guys about that situation. I'd kind of like some advice, just, if you guys think how I can get past that. Go on, Tiny, go. Just because, I always like you guys' advice. You guys give great advice. You're awesome like that. So, yeah, so we'll talk about that a little bit and dress the babies. And I think that'll be a fun day. What do you guys think? Does it sound like a fun day? I think so. Here's a t-shirt to go with that. Okay, so, starting out, I think we're going to dress some of the ball jointed babies today, which are my Ping Lao toddlers, because I haven't dressed them for a while, and I think that would be fun. I have to tell you guys, I was watching a Dr. Phil episode, and I thought it was so offensive, this whole situation that Dr. Phil was talking about, because what it was, Dr. Phil had some woman on his show who was a Reborn collector, right? And he decided to have his special guest, which, is not that unusual. He usually does. It's like a lawyer or, whoever. But in this case, his special guest was a comedian. And I thought that was really like in bad taste, because what is a comedian going to do? Like, what's their job, right? They're going to make jokes. So why, when you're talking about reborns, would you have a comedian on your show? That to me is like, it's setting it. Here's Tegan. We're going to start with her. It's like setting it up to be a joke, to be mocked. And I just thought that was so, like, so bad. I was like, dude, really? Like, you're not going to have like a psychologist or something on? If you can find the episode on YouTube, you should go look it up. But it's basically, he had these reborn moms on his show, and he involved a comedian in the show, which, like I said, to me just seems like he's setting it up for, jokes to be made and ridicule. So I kind of figured from the very beginning that that was going to be the case, that it was just basically like a drag fest on the reborn moms, which I thought was really crappy. I just didn't think that was good at all. Like, if he had a psychologist on or whatever, somebody like that, that would make sense. But to have a comedian on, that doesn't make sense except to poke fun at people. And I just thought that was in really bad taste. It was very mean spirited, It just started, the whole thing started out with, oh, let's mock the reborn moms. And I just thought that was really crappy. You can find it on YouTube. You can go watch it. And again, I don't know what his purpose was for having a comedian on, other than to make bad jokes about the reborn moms. So I think he had his mind, he said, let's try to understand this. And I don't think he wanted to understand it at all. I think his whole goal was to mock these women and make fun of them, which I think is offensive. Just, it's not nice. Don't do that. But that's what happened. And, one of the things I think is really a shame is that there are very few people who aren't in the community who ever cover this topic. And when they do, it's always some form of malice. It's either to poke fun at them or to make them, look crazy. It's like very few people cover this topic, and the ones that do, their whole goal is just to poke fun. And I think that's so sad, because it would be nice if, like, there are content creators who talk about all kinds of topics. And I think it would be really nice if a content creator actually went into this topic with the idea to try to understand it, to be genuine and try to understand what's behind it and the psychological benefits that reborns have. But it seems like every time I see a content creator talking about this topic, it's always with the goal of poking fun at somebody, or making them look crazy. They never try to really understand. And I think that's just mean-spirited. Don't do that. Don't bring people or comment on videos with the whole goal of poking fun at them. It's just not nice. I would like to see a content creator do a reborn video, like talk about reborns, but in a way that's educational, where they're actually trying to understand what's behind reborn collecting and reborning itself, and not for the whole goal of poking fun at these people, because it's, nobody wants to be made fun of, number one. And number two, there's nothing wrong with collecting dolls. Like, guys collect things all the time, and there are women that collect teacups and spoons. Reborns are no different, and it's not right to be mean to people simply because they have a hobby that you don't agree with. That's just not okay with me. So I just wanted to put that out there, because I thought that show was in such bad taste. And I just thought, like, when he first said, I invited comedian and then whatever her name was, I was like, what? Why would you invite a comedian? That's just mean. Like, that's not even right. So obviously his whole goal was to make fun of the situation from the very beginning, before he even got into the topic, was simply to make fun and poke fun and make these women look crazy. And I think that's so sad, because if you're going to do shows like this and you're going to react to different topics, you should go in with a blank heart. You know what I mean? You should go in to this. Hold on one second. You should go into reacting to any topic with an open mind, an open heart, and like really try to understand what's behind it and see what's behind it, rather than going into it with the idea of, let's make fun of this person, let's mock them, let's tease them. And I just think that's so sad, because you really could learn something, not you particularly, but I mean people in general really could learn something by doing shows like this. And I think that it's just sad when they miss an opportunity to learn and grow. And I just don't like it at all. I don't think it's right. I don't think that anybody should go into doing a reaction show with the whole goal of poking fun at somebody or making fun of somebody. It's not cool. Just don't do it. Yeah. So anyway, so that's what the Dr. Phil show was about. And I had seen that episode before, but I don't think I realized when I saw it before that that woman was a comedian, because I thought why would you bring a comedian on the show? Why not bring, a psychologist or somebody who can better help you understand and explain the reborn, what reborns can do and why people have them, as opposed to just poking fun at them. So anyway, I just thought I'd share that with you guys because I thought it was incredibly offensive that that's what he did. And again, it shows his shallowness. And Dr. Phil's a quack anyway, but it just shows his shallowness and his inability to even like think about the needs of other people. You know what I mean? I just thought it was very offensive and in very poor taste. I'm going to take these bows out of here. There's so much you can do with a topic like this to like learn, grow, and understand as an individual. So for them to just, just do it as some kind of mockery was just, yeah, it wasn't nice. And it just made me feel like really bad for the women who went on the show, because I think they went on the show with a very clear goal in mind, which was like, let's try to teach something, let's try to educate people. And then he just turned around and made a total mockery of it. So I thought that was pretty offensive. It offends me. It offends me. And more than that, it limits your ability to learn and grow. You know what I mean? Like, just don't do stuff like that. It's just not nice. So anyway, that was something I did today, was I watched that video. And I wish that, like I said, I wish there was more content creators out there who really wanted to learn about reborns and understand what they do for people and why people collect them. And frankly, I just don't see that happening. I see all the creators that I see that do reborning stuff, they do it for a laugh. They do it to make fun of people. And I think that's really sad. Because we can do so much more, we can be so much more than just mocking people. I mean, there are so many evil people out there, like the world is filled with evil and people who do evil acts, and you're going to focus your attention on doll collectors. Come on. Not that we're perfect, but we're certainly not evil, and we certainly don't deserve to be brought on a show for the simple purpose of making fun of us. It's not right. So anyway, I thought I'd share that with you guys today. And then I thought I'd talk about, like I said, I want to read that thing instead of just telling you about it, because my thoughts are much better organized when I have something in front of me. So while I'm doing her hair, I'll pull up that, that post that I was talking about so I can read it while I'm playing with the babies, and then I can tell you guys. So I posted it on an Am I the A-hole site, and the reason that I did that is because at the time I was seeing a therapist about the situation, and I thought I was in the wrong, and she said, I would like to see you get other people's point of view and see what other people think if they think you're in the wrong, which is why I posted it at all. I wanted to get an outsider, someone who's not involved in the situation. I wanted to get their point of view. So that's why I posted it to begin with, and I figured I would read it to you guys. Okay, let's see. And here it is. Okay. So I posted this in September of 2023. And again, I posted it because my therapist was telling me that I should get other people's point of view, because she felt like I wasn't in the wrong and I felt like I was. And so she thought getting an outsider's point of view would actually be really helpful for me. So that's why I posted it. And I'm going to read it to you guys today so you guys can understand why I have difficulty leaving the house sometimes. There's Miss Tegan. Isn't her pretties? Isn't her pretties? She's so pretty. All right, so I'm going to take a break from the babies for a minute and read this to you guys. Okay, so it says, here's a situation that happened in August of 2021. I am working on it in therapy, but I would like to share it with you guys. It has really affected my life and my emotional state. So I also posted this on a group that I started and that I run called Reborn Therapy Support, and it's a therapy-based group. So if you would like to join Reborn Therapy Support, you definitely should. It's a great group, and there's no bullying or anything. It says, what do you guys think? This situation has really affected me and still does. My therapist wants me to get an outsider's POV. So here's the actual post. Am I the a-hole for expecting help while covered in pee? I said, so this happened a couple years ago now, but it has dramatically impacted my life, and I want to know if I'm wrong. Relevant back info. I, 48 female, have a genetic connective tissue disorder called Ehlers-Danlos syndrome, or EDS. For anyone unaware of this disorder, it makes your joints dislocate and makes your joints, tissues, skin, and organs fragile. It also makes falls a commonplace and dangerous. Also, due to my EDS, my bladder muscles have stretched to the point where they no longer work. Because of this, 7 years ago, I got an SPC, or suprapubic catheter. This is a catheter surgically implanted in the abdomen that drains urine into a bag. Most people with an SPC use a leg bag that attaches to the leg under their pants. Unfortunately, because I need to wear braces, I can't use a leg bag, so I use an overnight bag that I usually hook on my pocket. All relevant later. Also relevant, I'm supposed to use a wheelchair, but the one I have is in desperate need of repair and a new battery, so I can't take it out on the bus or anything as it stalls. The battery dies fast and the chair constantly stalls. I also don't have a wheelchair vehicle, so when I do use the wheelchair, I have to use the bus. But when I don't have the wheelchair, which is now, I use my regular vehicle and use a walker. One day, towards the end of COVID, when masks were still mandatory but businesses were open, I went to Joann's Fabrics to get some craft supplies. As I was walking down one of the aisles, my hip gave out and I began to fall. I grabbed hold of the first thing I could, which was a display, and everything and me went tumbling to the floor. I hit my head hard and landed on my bag. I immediately had a mini seizure, which only lasted less than a minute. When I was finally oriented to my situation, I sat up and looked around. My urine bag that I had landed on had burst open, and due to the seizure, I was covered in urine. A manager very quickly noticed me and came over. She shook her head when she realized I took the display down with me. Although nothing was broken, I understood that it created more work for her, and I understand her annoyance. As she got closer, she realized there was pee all over me and the floor. I asked if she could help me up, and in a shaky voice, to which she took a few steps back, put her hands in the air, and said, "Our store has a strict policy regarding universal precautions, and I cannot touch you." She seemed annoyed that I had asked at all. For those of you that don't know, universal precautions are the precautions that people have to take when dealing with bodily fluids, like blood, urine, saliva. And there are guidelines of how they have to handle that in medical situations. I don't know if that's true in businesses, but that's what universal precautions means. I asked her if she could get gloves and then help. She wrinkled her face and said, "Ew, no, I'm sorry, but I cannot touch you." I asked if she could get someone else who might be willing to help, and she said that she couldn't in good conscience ask anyone else to do such a thing, but she would call for help. She turned around and hurried down the aisle. She was gone for a few minutes while I just sat there. She finally returned with 5 yellow caution wet floor signs, which she positioned around me and at the end of each end of the aisle. I asked if she called for help, to which she said not yet. She felt her first priority was to protect other customers from being injured or being exposed to bodily fluids. Then she left again. She returned after another 8 to 9 minutes with 2 employees whom she positioned at either end of the aisle. As a customer approached, she stopped the customer and said, "This aisle is closed because it is covered in pee." She said it very loudly, and this caused curious onlookers to wonder what was happening and wander in my direction. Then she left again. She returned after maybe 5 minutes, saying she called for help and that they would be there soon, so I sat. After another few minutes, a group of teenagers walked by and pointed and snickered, with one commenting on the fact that I smelled. She said that to the employee guarding the aisle that it was unacceptable that they should be subject to this while shopping. The employee just shrugged and replied, "What can I do?" After a few more minutes, a large muscular man walked by with an older woman. He stopped when he saw the teenagers, who had now pulled out a cell phone and were videotaping me. He pushed past the employee and smiled at me. "Can I help you?" he asked gently. The manager was walking by and said, "Nope, nope, nope, absolutely not. I cannot allow customers to put themselves at risk for this." The man explained that he was an ER doc and that it was actually very difficult to catch anything from urine. He explained that urine was sterile and the high acid levels made it hard for any bacteria to grow. He said gloves would be enough. The manager argued with him, saying she would not allow it and would not provide him with gloves. He shrugged his shoulders and said, "That's fine. I'll take the risk." He reached for my hand and began to pull me up when she grabbed his arm and yanked him back, causing me to tumble to the floor. I was so humiliated and embarrassed at this point that I just burst into tears, sobbing and sniffling. She then positioned herself between us and said it was illegal for him to walk in between the wet floor signs. I had never heard that. If he continued, she would be forced to call the police, to which he turned to her and said, "I absolutely hope you call the police. This is outrageous." After our 10-minute heated exchange, the manager stood in front of the man and demanded he leave the aisle. I think he was exasperated and finally shrugged his shoulders and walked away, apologizing to me as he turned around. I sat there for over 20 minutes waiting for help. From time to time, people would stop and ask if they could help, to which the manager repeated the same claims. Some others just stood and stared. Some commented about the mess, and some laughed and pointed. One young man said I should try diapers as he walked past me. After nearly a half an hour, an ambulance crew finally showed up. They donned their gloves and helped me off the floor. The ambulance tech was incredibly annoyed with the manager because when she had called 911, she had specifically stated that there were no injuries and that the patient was medically stable and only needed help getting off the floor. Because of this statement, the ambulance crew did not see the incident as an emergency, thought it was a routine call, so they hadn't rushed. Once the ambulance crew showed up, I told the EMT what had happened in detail. He noticed some blood dripping down the back of my head and became incredibly annoyed with the manager, claiming she should have stated it was an emergency. When someone falls enough to cut their head and have a seizure, that is a medical emergency and should have been treated as such. The manager was very snarky and defensive, saying she hadn't seen the seizure, that she had only been told the info by me and had no way of knowing if it was indeed true. She claimed that she was not a doctor, and because of that, she could not adequately assess the situation. The EMT yelled at her, "Exactly, which is why you should have told them it was an emergency." By claiming everyone was stable and there was no medical emergency, it delayed medical treatment that could have led to disastrous results. The ambulance crew helped me up and put me in the ambulance, took my vital signs, and took me to the hospital. I was only there a few minutes, and had no major injuries, although due to the seizure, I had increased weakness on my left side because I already suffer from partial paralysis. So then I go on to talk about how it affected me, but I can do that without reading. So now when I go out, I get really anxious and I feel like what if that happens again? What if I end up on the floor again and I have to sit there? It was really embarrassing. It was really humiliating. And I really blamed myself. I felt like I was in the wrong for asking her to help me. And so I think that's when I really stopped going out and being more social because I was so afraid that that would happen again. And, I just don't know. I'm so afraid it's going to happen again. And so now when I go out, I just go out very limitedly. I don't go out and hang out like I used to. I just don't. And it's the anxiety, it's the anxiety of what if a similar situation happens? What if I'm in a similar situation? I was so embarrassed and so mortified by that situation that I just don't want it to happen again. So I don't know if I was right or wrong in asking her for help, but I don't think that the way what I've learned, when I was in therapy a few years ago, is that I don't think she handled the situation correctly. I think she made it a spectacle and she embarrassed me and made it worse than it needed to be. I used to think that maybe she was just right about the universal precautions and that she was justified in what she did. But as I got more and more people's advice and opinion, I learned that she really didn't have to make it as big a production as she did, and that she only did that to make a spectacle out of it. So that's what happened. That's what I refer to when I talk about the situation that kind of changed me. Before that, I never had any social anxiety. I never had any issues going out. In fact, I really enjoyed going out, but now I don't enjoy it as much. I really like being at home where I know that if something happens, it's not going to be seen by the entire public. You know what I mean? And especially nowadays with everybody recording everything, I would be mortified if something like that ended up on the internet, on YouTube or on TikTok. I don't even know what I would do if I logged on and I saw that. That would hurt so much. So yeah, it really has affected me. I did work on it in therapy for a little bit, but I've stopped therapy since. But it just causes me great anxiety. I'm so afraid that a similar situation will happen and I'll end up on YouTube or TikTok or something. And people on the internet, I don't know if you guys probably do know this, but they can be really cruel. And I don't think I could handle seeing that on the internet and then all the comments that people might make. You know what I mean? So that's what happened, and that's what caused my great anxiety about going out. And I know it shouldn't affect me, but it does. It affects me a lot. Even now, although I'm less anxious than I used to be, even now when I go out, I'm super anxious about it. Super anxious that something like that will happen. And I won't, I won't be able to, I don't know. I don't know what I'm thinking, but just super anxious that that'll happen at all. So I hope that makes sense. That's why I get anxious about going out. And I don't mind not going out. I don't mind being at home. I actually really enjoy it. I feel like it's a shame that it's the reason I don't go out is because of that situation rather than because I chose it. So there's Miss Morgan. Isn't she so cute? I love this baby. Her and Heidi. I love their facial expressions. They're so cute. Look at that little lip. You just want to smushy that little girl and snuggle her. Let me grab Heidi. There's Miss Heidi. Here she is. So I don't know. What do you guys think about that situation? Do you think I was in the wrong for asking her to help me while covered in pee? Or do you think she was wrong in the way she handled it? I'm always curious about you guys' opinions. You guys always have such great advice. But that was the situation that happened. It wasn't anything major like a car accident or anything like that. It affected me, I think, because of the loss of control and the way that it was handled. I think that's why it affected me so greatly. But I try not to let things get to me like that, because I don't know. I don't know. I try not to let things affect me like that, but they do. I would be lying if I said they didn't. Do any of you guys have mobility issues? Do you ever feel like, you're afraid that something like that will happen to you? And does it affect your ability? Like, I have never in my life suffered from anxiety up until that situation, until after that situation. I just was not an anxious person. And now I'm very anxious when I think I'm going to go out. I think I feel better like when I go to my local supermarket because I go there like a couple times a month and it's the same supermarket I've been going to for years. So I think I feel comfortable there because I actually know some of the staff. So I think I feel less uncomfortable when I go there, but I still get anxious going out. I just don't want to end up in a situation where I can't do for myself. You know what I mean? So that's what happened. That's a lot of times in my videos, I've referred to a situation that happened that affected my ability to be social, and that was it. So I just wanted to share that with you guys because I think it's important. Not only to get other people's point of view, but I want you guys to be able to know me and understand me. If you're going to watch my videos, just like I would really love to get to know you guys and understand you guys a little better. I think it's important for relationships to understand each other and to know each other. This is so cute on her. Look at this. Look at that. She looks so cute. She really is such a cute baby. I am in love with Heidi. Heidi, Morgan, Clarabelle, Gretel. My Ping Lao toddlers, I think, are my favorite babies. Yeah, just love them to pieces. She does expressions so well. And that's a really hard thing to do. Like, it's hard to sculpt a baby anyway, but it's also really hard to sculpt expressions frozen in time. A lot of times when you do expressions frozen in time, they look awkward. Like there's a couple of smiling babies, although I can't think of their names right off the top of my head, where the smiles look really awkward because they're frozen in time and there's no variation. But Ping Lao just does such a good job with sculpting expressions and babies. I think she just does an awesome job. I love her babies so much. What do you guys think of that new crying baby? I don't remember. What is that called? Is it Khalitha or... I'm trying to remember what the new one is called. Anyway, it's a baby in mid-cry. And it's, I love Ping Lao's work, but that one's just not for me. I'm not a big fan of crying babies anyway. I think because I always feel like I want to comfort them. I always feel like I want to stop their crying, and you can't because it's like permanent cry face, you know, so you can't really stop it. But I think that's why I don't like them. I think it's because I feel like I want to comfort them, and you can't, you know, you can't change their facial expressions. So yeah, I totally I totally think that's it. I feel like I had a crying, I think it was a Quinn by Bountiful Baby. I had, or was it Quinn? Might have been Quinn. Clyde? I don't remember. Anyway, there was two. There was Awake and Asleep, and they were like screaming babies. And I had them, and when I first got into Reborns, and I just constantly felt like I wanted to calm them and I couldn't. So it just left me feeling, I don't know, it didn't make me feel better. Like, you know, how the Reborns make you feel better and more peaceful. It didn't do that. It actually made me feel anxious, I think, because I couldn't get rid of the crying face, you know. So I think just for me personally, and a preference thing, you know, the crying babies just don't work for me. But I know a lot of people who do like them. It's just not for me. Let me put some socks on Clarabelle, and then we'll dress her, and then I'm going to take some pictures when I get off the video. I want to thank you guys who watch my videos. I truly love you guys, and I'm so grateful for each one of you that you watch my videos and that you allow me a moment to come into your lives and kind of be a part of your everyday life. That just makes me feel so good. Thank you so much for that, for those of you that have subscribed and that continuously watch my videos. I know it's not many, it's probably just a few, but I am so grateful for each and every one of you that you just give me that moment to come into your life and be a part of your world. It's pretty awesome. It's pretty amazing, I think. And it feels pretty amazing to me to be able to come into your lives and be a part of your world, because, you know, we live in, with the world of technology we live in, we live pretty solitary lives. I mean, except for our families, you know, we really can order anything we want. We really don't have to go interact with people. And so it's really nice that you guys take that time to let me into your life and to bring me a part, make me a part of your reality. That's awesome. Look at the collar on this. Isn't that beautiful? So I just want you guys to know that I'm incredibly grateful for you guys, each and every one of you that takes the time to watch my videos. You make me feel really good about myself. So I'm going to let you guys go, but definitely do something good for somebody else this week and take a chance. I'm debating on whether I keep doing the prayers because I know not everybody is religious. So tell me in the comments what you guys think. Do you like the prayers, or do you not like them? Do they make you uncomfortable? Because I would love to get your input. Okay. Anyway, I'll talk to you guys later. Bye.